Most problems related to colds or ear infection can be treated and also diagnosed by a pediatrician. However, when this problem or these problems become recurrent, then they need to be evaluated by an ear, nose, and throat physician. Tonsillitis essentially refers to inflammation or an infection of the tonsils, and it is usually associated with sore throats, perhaps a low-grade or a high-grade fever, difficulty swallowing, and throat pain. The symptoms can last for several days, sometimes a little longer, and if the symptoms usually do not resolve over a course of 48 to 72 hours, then it's perhaps prudent for the child to be evaluated either by a pediatrician to begin with, and then referred to the ENT physician if appropriate. It is normal or common to have a cold, but when it becomes recurrent, as in 3 to 4 times a year, that's the point where it's not normal, and that's the point where a child needs to be evaluated by ear, nose, and throat physician to see if there's any underlying abnormalities. It could be related to having enlarged adenoids. Also, it can be associated with fluid in the middle ear space. That could be a consequence, actually, from the frequent colds or sinus infections. Ear infections are relatively common, especially in children between ages 6 months and 2 years. They are more common in those children who are in a daycare or preschool environment. A parent can consider seeing an ear, nose, and throat physician if, for example, the child has recurrent ear infections with 3 to 4 ear infections over a course of 6 months. When we see these children in our office, we do an ear exam, and we also check their hearing to see if there is any impact from the ear infections on hearing loss, perhaps. And depending on the physical examination findings, the findings on the hearing test, as well as the number of ear infections and other risk factors such as being in daycare, or if the parents have had a history of ear infections, then we may or may not consider the option of putting tubes in the ears, which is one of the treatment options related to management of ear infections. The primary modality of treatment is an antibiotic by mouth, which we usually use amoxicillin or Augmentin or an antibiotic called Zithromax. Here at Rush Oak Park, we do have audiology, for example, so if a child needs to be evaluated for ear infections and possibly fluid in their middle ear space, then we can do the hearing test at the same time. On the other hand, if a child is here for evaluation of mouth breathing, nasal congestion, and we have to do allergy testing or, for example, getting an x-ray of the neck, we have the capability of doing all of that here within our facility. I love serving patients. I love making people better, improving their quality of lives, and this is all I wanted to do most part of my life since I was a kid.